Hi, my name is Steven and I'm the nurse that's going to show you how to do the dressing change on your PICC line. Before we get started with the actual dressing change, two things you want to remember. Just make sure that the area you're working in is nice and clean, that any surfaces are wiped down, and then also to make sure that you clean your hands with a sanitizer or just soap and water. Just make sure that your hands are nice and clean before you touch any of the dressings or the actual PICC line. Alright, so before we actually start the dressing change, we want to make sure we have all the supplies we need to do the dressing change. You want to make sure you have at least one pair of clean gloves for taking the old dressing off, and then you'll also have a PICC dressing site care kit that you can get at the Mayo Clinic store or other medical supply store. In the kit, they usually come with 2 masks, one for yourself and one for the person actually getting the site care done. One pair of sterile gloves to handle the PICC line and clean the PICC line with the dressing off. A tape measure for measuring how far the PICC line is out from the skin. An antiseptic cleanser like this ChloraPrep swab. Besides what comes in the kit, you also need a Biopatch or other antimicrobial disc to put around the insertion site, right where it goes into the skin. You'll want a new dressing, like this Sorbaview shield, that will go on after you've done the site care. And then if you're changing the caps, you want to make sure you have however many caps you'll need for how many lines are coming out. And then also it's nice to have a pen handy so you can write the date of when you're doing the dressing change. That way the next person will know when that dressing change happened. Now that we know that we have all the supplies we need, we can go ahead and take the old dressing off. So to do that, we want to make sure that we're masked up first. So we want to open our site care kit, and inside should have 2 masks in it. One for you and one for the person getting the dressing change. So we want to make sure that we put that on ourselves and then have the person that has, if they're able to, have them have a mask on as well. If they're not able to wear a mask, they can turn to the side and face away from the PICC dressing site. For demonstration purposes, I'll just remember that I have a mask on. Now that we're masked up, we can go ahead and remove the old dressing. So we want to put on that clean pair of gloves. To take the dressing off, we'll want to start at the bottom edge and start peeling back the dressing towards the PICC site. Once you've gotten enough of the dressing up so that you're close to the transparent window, you can tear the dressing right underneath where the catheters come out and tear it apart at that seam there. Once you have the bottom of the dressing up, then you can start peeling around the white edges on all sides towards the middle window area. Once you have all the white edges up, you want to make sure that you either hold the line to the arm or place a strip of tape across to hold it in place while you peel the rest of the dressing up the arm and off of the patient's arm. Alright, now that we have the dressing off, we want to make sure that we take the antimicrobial disc, Biopatch, off. So being careful not to touch the insertion site, you'll see that there's a slot on the side there, and you want to turn that so that it comes up around both sides of the catheter and carefully remove it. Now that our site is clear, we can go ahead and change and open our sterile kit and do the actual cleaning of the site. So take off your gloves that you used and throw them away. Make sure to wash your hands again. Alright, to open your site care kit, you want to make sure you grab from the edges and only touch the napkin on the corners on the edges and not in the center where it's sterile. So just carefully peel it open and try to get it to lay flat. So this is your sterile field. Make sure that you keep your masks on until the dressing site care is done. So being careful not to touch it, you can reach down and just pinch the gloves out from the middle of thing and lay them to the side here. Those are your sterile gloves that you'll use for the dressing change. Then you want to take those other supplies that we get gathered and carefully open them and drop them onto the field that we'll be using. So the Biopatch, you want to just carefully open the packaging and then turn it upside down and let it drop onto your sterile field without touching it. Do the same thing with your Sorbaview shield dressing. Carefully open it without touching it. And then turn it upside down, let it drop into your sterile field. And then if you're changing the caps, you can open and drop those on the sterile field. All right, now that we have our sterile field set up here, we can go ahead and put our sterile gloves on so that we can handle the items on the sterile napkin. So to open your gloves, you just hold the edge of grab the edges of this napkin and fold them open. And this is kind of one of the trickier parts of how to put sterile gloves on, but just do your best. So with the first glove, you want to put them on one at a time. In the first glove, you try to only pick it up from this cuff that's folded outward. So you're just touching the inside cuff edge with one hand. And you put the one glove on the one hand so that the outside of the glove is still sterile. And then with that glove, you want to pick up the edge of the hem of the next one without touching your hand and carefully put the other hand into the glove like so. So now both of my hands both the gloves are sterile, so you can touch the other sterile products in the thing. I just want to go over one thing about the sterile dressing. So this is the main one. We sometimes refer to this as the shirt. And then there's a bottom portion of the dressing that we call the pants. And they kind of go over each other like this. You put the shirt on first, and then underneath the catheter, I'll show you when we actually put it on. This comes around the bottom of the catheter like this. Okay, the first thing that we need to do is to clean our area. And so with the ChloraPrep, it has these two handles on the side of it. And to activate the cleanser, you need to pinch those together till you hear a snap. And you'll see some fluid running down into the sponge. So if you hold it upside down, that fluid will run into the sponge. And you don't want to touch it, but it's just, that'll get wet. And then using back and forth scrubbing motions, we want to clean the site really well all around the insertion site where the dressing will be. You want to be careful not to dislodge the pick at all. So you want to be careful as you're doing it around the insertion site, but you want to clean really well with back and forth motions, not only the insertion site, but all the areas around it where the dressing will be. You want to scrub a good 30 seconds, get good contact time, and make sure that all the germs are being killed around that area. Once you scrub for 30 seconds, you want to make sure that it dries completely. We want to make sure that we don't blow on it or wave your hand on it to dry. Just let it air dry over itself for 2 full minutes. Once it's dry, we can start putting the new dressing on. So we start with the Biopatch, and you want to make sure the way it's designed, if you remember when we took the old one off, that there's a slot on the side of it that's going to wrap around the line. We want to make sure that the letters that are printed on it are facing up, and then the white side is facing the patient's skin or the person's skin. So we'll take that slot and we'll open it up, and very carefully we'll want to wrap it around the insertion site. You want to make sure it goes under under the insertion site just a little bit and turned about 5 degrees or so that it's making full contact on the skin, 365 degrees around the insertion site. Once we have the Biopatch on, we can put our shirt on the top portion of the Sorbaview dressing. So there's 2 tabs on the back side of the dressing, and we're going to peel this top section off, and you can kind of hold it with your thumb in the middle here, kind of like a slice of pizza, and you peel back that portion so you have the window portion of the dressing open. So you want to put the shirt on with the top of the shirt towards the armpit, and we want to make sure that that biodisc with the insertion site is in the middle of that window area so that it's fully visible through the window. So we go ahead and put that down and kind of press down kind of around on that window area first to make sure that that's nice and has good contact with the skin first, and then you can kind of work around the outside edges of the white portion of the dressing so that part is in place. So now you see this little slot here. You want to make sure you pull the lines out through that slot and peel back the second part of the dressing, which is right here. And kind of pull them up as you secure kind of around and below so that they overlap underneath your PICC lines as they're coming out. Once you have that top dressing in place, you can take the pants part of it, that second smaller piece, and this one's going to slide up underneath the catheters. So if you pick up the catheters and slide it up underneath it here, it's going to overlap going upwards around those two catheters coming out, or however many lines you have. And then there's two tabs on either side. Once you have it in position like so, you want to peel back each side of that dressing and tape it down and do the same on the other side. So now that's the dressing is in place. So with your mask on and your gloves still on, if you need to change the cap, so we want to make sure we do that as well. So we take the new cap, and you try to remember if there's more than one line coming out, you want to make sure you remember which one you're changing. So I'm going to do the red one first. I'm going to, holding this new cap in place with this hand, I'm going to screw off the old cap, put it aside, careful not to touch that. You want to take, there's a little clear plastic protector on there, you want to twist that off, and then very carefully you want to insert that end onto the new cap onto the line and screw it down until it's on. So did the red one, and we're going to do the same thing with the purple line. You're going to hold the new cap with this hand, pick up the line, carefully screw off the cap, being careful not to touch the open exposed end of the line. Take that plastic covering off and then carefully screw the new cap on in place. So that's how we change the caps. Once all the dressing has been changed and the caps are changed, now we can measure and make sure that the line was not dislodged or moved at any point since the last dressing change. So we take our tape measure, and in the hospital we use the centimeters. We'll measure on the centimeter side. And so what I like to do is I kind of try to fold over right at the 0 mark of the tape measure. And then what I do is I turn it kind of upside down like this, and I put that 0 mark right where the PICC line is going into the body, and I measure out to this darker purple hub. So that's close to 2 centimeters out from where it is. So you want to write down and remember that 2 centimeters. If that's more than 3 centimeters from when it was placed, you'll want to contact your nurse or doctor and let them know. So you want to make sure that that's in the right position inside the body. If it comes out too far, they might have to get it replaced or reposition it in the hospital. So we want to mark down that measurement. And we also want to measure around the arm to make sure that there's no swelling. That might be a sign of an infection or some other problem. So to measure that, you want to find the top of the shoulder bone that comes out. So you want to measure between the top of that bone and the insertion site. Here's 28 centimeters. So half of that would be 14 centimeters. So find your 14 centimeters up and then measure around the arm. So you want to mark that measurement down. And if that has changed since the time of placement by more than 3 centimeters, you want to contact a healthcare professional to determine if there might be a problem with your PICC line. Once all the dressing has been changed and you've done your measurements, then you want to make sure that you put the date on of what time you changed it. Usually there's an extra sticker for that purpose on the Sorbaview dressing. You want to make sure that that's somewhere on the dressing. I like to put it on the side so it's not in the way of viewing the PICC insertion site. Now that you know how to change the dressing on your PICC line, if you have any questions or concerns about infection or other problems related to your PICC line, please contact your healthcare provider right away.